So in terms of my reflections on learning, obviously it's harder than it looks. Anything in medicine is hard to change, right? You always get pushed back. It's just the personality of everyone involved. And this obviously is harder than it looks because I thought my project would be very easy. Everybody's going to say, oh yeah, that makes sense, let's do it. But you need data to do it, right? With everything. So it always is harder than it looks. So it just means that it's probably worth doing when it's harder than it looks, right? And for the people who are coming in with Cohort 3, it's a great experience, I found. So I really just wanted to find a way to improve a very small part of the medical system in order to provide better care for patients. So blindly following dogma in medicine has been classic forever, especially in surgery. It's, this is the way we've done it forever. If it works, why fix it? But there's always room for improvement. So that it showed me how to inspire change in people because, you can start something and then it just doesn't get take because either people aren't all engaged with it or they just don't accept the data or the numbers that you're giving them. So you can't dictate from the top and say this is the way we're going to do it. You've got to involve everybody, and this program really teaches you that and tries to teach you ways in inspiring people. I think that's great. It takes a ton of preparation. It takes a lot of people. You can't do it on your own. My project, yeah, I didn't get a lot of time to dedicate to it, and then I really didn't get everything done that I wanted to, but what I learned from it is way more than what I'm going to do. And eventually, I will work with it more and more and try to inspire more change, but the stuff that I learned really was helpful. So in order if it is something to improve patient care and lead to efficient use of healthcare dollars, et cetera, it's well worth the effort, right? And people will accept that once you show that. So this program showed me how to inspire change, lead a team, determine those factors that are important. So I came up with things and other people came up with things in my project that I never even thought about. And then question what can be improved upon. There's always room for improvement everywhere. And then design ways to test those processes. So that's what you'll learn in this project. So I even use it at home. Daddy makes the best pancakes on Sunday. So everybody wants to help Daddy with it, and they always fight. So I use all these different, learn about these PDSA cycles and things. And how do we get things, who's going to put together the wet ingredients and the dry ingredients, et cetera. So over time now, these guys can make pancakes with me. I use it in the OR as well. Different ways of approaching things. So when I'm rooting around with the pulmonary artery there, are there different ways of approaching it? So each time I'll think about it differently, and this program has inspired me to do that. So all in all, it's a great program. You're teaching those on the front line of medical patient care on how to change that system, because we all, obviously we're in the room because we're here, because we all have something that we want to change and improve patient care. In terms of professional development, I just want to continue my project, obviously, participate any way I can in helping the other cohorts, and then encourage others to participate in the program.